From WisPolitics in Madison, you're listening to Capital Chats.
Hello, everybody. This is Kate Morton with WisPolitics here with a Capital Chats podcast brought to you by Spectrum. Today, I'll be sharing an interview with Dr. Jerry Halverson. He is the chair of the Wisconsin Medical Society Board. He's a psychiatrist, and he is the chief medical officer for Rogers Behavioral Health. So we talked a little bit about some of the big healthcare-related issues concerning the state right now. Here's what he had to say. Thank you, Dr. Halverson, for joining me on the Capital Chats podcast today.
You're welcome. My pleasure to be here.
Yeah, I think to get us started off, could we talk a little bit from your perspective, what are some of the most significant healthcare related issues in the state right now?
This is, as always, a big time for healthcare. Funding continues to be a huge issue with the concerns about Medicare and Medicaid block grants that are being cut. Access to care will be affected. So I think those are the biggest concerns. Clearly, there's a lot of, we're talking a lot about vaccines at this time of the year, particularly the COVID shots, flu shots, all of those are also big issues. But I think overall, access to treatment, whether it's how it gets paid for or whether you have healthcare to even get access to in different parts of the state, I think those are really the top issues that we're dealing with right now. And again, unfortunately, they're not new issues, but they're particularly acute at this point.
Yeah, I want to ask you about a couple of those. I guess we can start off with talking a little bit about Medicaid access. So, as you know, Republicans' One Big Beautiful Bill Act, it's projected to leave millions of people uninsured. I'm wondering how profound do you think the impact will be in Wisconsin, and what will that look like for both healthcare providers and also patients?
Yep. So I think there's a lot of that is to be determined. I can tell you that here in Wisconsin, we've generally done pretty well with getting most of the people in the state access to care, whether it was through Badger Care, the local Medicaid or Medicare or private insurance. Historically, we've been great at that. Which really allows us to, as physicians, allows you to see the patients before they get sick and hopefully avoid some of that catastrophic care. There's obviously a lot of concern that a big part of that was Medicare and Medicaid. Both of the fundings, we did not take the match here in the state. So it's not going to be as drastically affected as some states are. But at the end of the day, there's a limited number of dollars out there, and whether Medicare is going to end up getting cut or having people have access to other types of Medicaid funding, which happens through block grants through the state. We're very concerned that that's going to affect people. As a psychiatrist, I can tell you a lot of my patients depend on the funding that they get through those payers. And without without that backing, they're going to lose access. They're not going to be able to see the doctor to get the treatment that they need to prevent that catastrophic illness that we were talking about earlier. So there's a lot of concern about that.
Yeah. So that's one of the big things that's going on right now. I guess, are there any options for people who are kind of concerned about this to kind of mitigate these concerns?
All that I can do is I could say, certainly use the access when you have it, because it's not clear what's going to happen moving forward. I think right now, while you have access, making sure that you're getting all of your primary care and making sure that you're as healthy as you can be is important. I do think talking to at this point, talking to your legislators continues to be important. They need to understand the face of Medicare and the face of Medicaid funding, definitely through the state. There are a lot of people that depend on this. Again, I think they have, not a lot of my patients are, 30-year-old men playing video games in the basement, which is what they want to make this look like. There are a lot of families that are dependent on this. And I think people have to understand that, certainly if things happen like work requirements, it's going to be important that people understand that process and how to make sure that you continue to get those, access to those benefits. I think there's a lot of concern that if that process is onerous and people don't follow through, then they definitely will lose access to the treatment and access to, the good doctors and the treatment that they need. So unfortunately, you really have to pay attention, and a lot of this is still in the air.
Yeah. Another issue on the national level is, under RFK Jr., the U.S. Health and Human Service Department is considering a lot of big changes to vaccine recommendations for childhood vaccines, COVID vaccines. Some people have concerns that those changes could maybe make it harder for people to get access to vaccines. Do you think that's a legitimate concern for Wisconsinites?
Absolutely. We've already seen that it's a legitimate concern. I mean, our governor, we really laud Governor Evers for stepping in on vaccine access. I know there are other states where it may be difficult to get it may be more difficult to get a vaccine that can really prevent, death and illness like the COVID vaccination, because there's these extra layers and extra hoops to go through. We've been fortunate in our state to have Governor Evers kind of step forward to make sure that some of those layers that the FDA and CDC would like to put in are not there, at least in this state, but that certainly is affecting people that we have in other states. The other issue that I think, you brought up specifically, we look at our policies here at the Medical Society every 5 years. There's kind of a built-in 5-year review where we look at policies, where we want to make sure that policies are still current, whether they're needed or not. And we have historically had a lot of policies that basically say, well, whatever the FDA says, whatever the CDC says. And we've had to really change those policies now, because we do not believe that the FDA and CDC at this point are always making the recommendations that are best for our patients. We've been very fortunate to have national pediatric, national family practice, psychiatry groups kind of going out there and speaking against some of these recommendations that we think aren't helpful. I would say the vaccinations are a prime example of this, where we feel that access to vaccinations should not be encumbered at all. And we do feel that it is, the government is getting in the way of people getting these life-saving treatments or life-helping treatments.
Yeah. Another issue that I wanted to get into a little bit is rural healthcare access in Wisconsin. This has been something that's been really talked about in Western Wisconsin, especially with, hospital and clinic closures, things like that. So I guess, where do things stand right now in terms of healthcare access in rural Wisconsin?
So it continues to be a concern. This has been something that's been on the Medical Society's radar for a long time. What we've been continuing to push is ways to get more physicians into the rural areas. If you look at some of the rural, at most of the rural areas, it's because they don't have access to any providers, let alone physicians or nurse practitioners. And we have been working hard to try to make it easier for physicians to relocate to that area in order to be able to provide that care. If you don't have physicians in that area, then really the care isn't going to improve, and it's going to continue to be a problem. Unfortunately, this isn't really a new topic. It has been worsened by some decisions that have been made by some hospital systems. And some other hospital systems have kind of stepped up to try to help as they've left. But again, far and away, this is not a new issue. And this is something that we've been working on and looking at through a workforce lens for a long time. It's also difficult to recruit physicians to a certain area when they're the only people in the area. It makes it less of an attractive situation if you're the only doc in a city versus having a team that is able to split responsibility and split the care, because people aren't able to be doc 24/7 like they used to be. Everybody's looking to be able to still enjoy. If you're going to move to the rural Wisconsin, you want to be able to enjoy a lot of the amenities in that area, and being the only doc for 50 miles is a lot of stress and pressure, and really doesn't allow you to be able to take that time off. I know we've had my day job is chief medical officer at Rogers Behavioral Health. We've worked with the state, and we're going to try to stand up some behavioral health care in the Chippewa Valley, which has been needed for a long time. So we're very happy that the state has stepped up and will help us place treatment there, as far as an inpatient unit and outpatient treatment that frankly has never been there, and is more needed than ever. And part of that has been that the state has stepped up and helped us make that possible.
Mm-hmm.
So we appreciated that.
Yeah, I guess beyond, new facilities and also kind of attracting doctors to these areas, are there any other areas you think need to be addressed to kind of help with this problem?
So I think telemedicine, particularly since the pandemic, has been embraced and has been utilized well. From a psychiatry perspective, a lot of what we do can be done with telemedicine. Obviously, if somebody is actively trying to kill themselves, or some levels of addiction care, we have found that virtual care isn't as safe or isn't as good, but a lot of the care has pivoted to virtual care. I do think, having been a clinician for 25 years and spending time in the same room with a person, it's very different than virtual. But virtual care has offered access to treatment that people used to have to drive 5 or 6 hours for. So that is something that continues to grow and continues to be important. Obviously, I think we do need some in-person treatment, but access via telemedicine has been huge. And frankly, a lot of the flexibilities that came with telemedicine came with COVID, and some of those flexibilities are threatened at the federal level through some Medicaid or Medicare rules, and that's something that is also important for us to continue to keep available for patients. So I think telemedicine has been extremely helpful with this.
Yeah. Are there any examples of changes to telemedicine that could maybe make that more complicated?
So prior to COVID, you could do telemedicine, but you had to be at a hospital facility. The patient had to be at a hospital facility. So we our closest hospital facility. So let's just take the Rogers example. We had a clinic in Appleton. If you were somewhere up north, you could, you had to drive to Appleton in order to be able to have me as a physician see you virtually. The pandemic opened up this to the patient being able to be at home versus at a hospital-owned facility, which took that drive away. You can make arguments that maybe it's not the safest place oftentimes for people to be getting treatment at home, but it's the most convenient, and it certainly is a place to start. So if they just started to take that away, the ability for the patients to receive care from home versus going into like a hospital clinic area, that I think would affect the uptake pretty drastically.
Yeah. Is there anything else before we wrap it up that you want to add on the top health issues in the state at the moment?
I don't think so. I think we pretty much covered what we need to. I mean, obviously, the medical society is here and has always been here to continue to press for access to excellent physician-led care, and part of that is having the funding and getting it paid for so that people have access to that. And as I said, it's not a new issue. There's concerns that Wisconsin has done well with this in the past, and there are concerns that we might lose that here at the state level. But obviously, we're doing what we can to make sure that that doesn't happen. As we think, in order for Wisconsin to stay healthy, they have to have access to good physician-led care.
Well, thank you again, Dr. Halverson, for joining us on the podcast today.
Thank you. Have a great day.
All right, thank you for tuning into the interview this week. If you want to learn more about healthcare-related issues, you can head to our website at wispolitics.com. But for now, I'm Kate Morton. Thanks for listening to WisPolitics Capital Chats, brought to you by Spectrum.